Well, hey, it's evening, not afternoon. Good evening, everybody. This is Congressman Adam Kinzinger. I hope your day has gone well. I hope you had a nice weekend. I'm in D.C. today, and I hear you guys got a little snow or something like that. Hopefully that ends very soon, and we get back to having a good spring and summer. Look, I just wanted to take an opportunity to chat with you guys. We have three doctors on the line who are going to be really fantastic to listen from, but we wanted to speak about the situation with vaccines and COVID, as I know there's some questions out there, some concerns, some interest. I'll repeat this a lot because we're still going to be calling people for the first 15 minutes or so. But if you want to ask a question, if you want to get in the queue to ask a question, hit *3. So hit *3 on your phone. That'll get you in the queue. Again, we want to talk about the situation with what's going on with the vaccine. Any questions you have? I know there's a lot of, misinformation that's running around out there. There's some questions about, who should or who shouldn't get it. And so this is our opportunity to get those answers. So again, *3 if you want to ask a question. And again, I appreciate this opportunity, taking a little time. We have three doctors on the line with us. All of them are experts in this field. I want to give you just some top-line stats here very quickly. So as of, today, Illinois is administering an average of 125,000 vaccines per day. 26% of the population in Illinois is fully vaccinated, and just about 79% of people over the age of 65 in Illinois are vaccinated. As of now, after about a week ago, any resident age 16 and up is eligible to be vaccinated, and so we're en route. We're getting there. We're doing what we need to do, and that's a good thing. That'll give us an opportunity to get back to life as normal, continuing to be vigilant. Using the things we've learned to keep from getting sick, but we can start getting back to life as we remember and we love it. I know that there's been some questions and concerns about the Johnson & Johnson vaccine and how that was paused. There have been 6 cases of blood clots. All of them were among women between the ages of 18 and 48. Symptoms were occurring a week to 2 weeks after vaccination, but it was 1 in 1 million. So CDC is doing their job looking at some of those issues, but according to the government, there's a possibility that gets lifted by Friday. Of course, the real concern is that people will look at that and say, "Oh my goodness, it's bad." It's not. So we want to dispel some of those as well. Again, if you're just joining the call, *3 if you want to ask a question or you have a statement. I want to introduce the three doctors we have with us, and I'll turn it over to them for some opening remarks, and we'll get to your questions. So we have Dr. Vishnu Chundi, chairman of the COVID task force for the Chicago Medical Society. Dr. Chundi is also a senior partner at the Metro Infectious Disease Consultants, which she joined in 1995 and is now the largest infectious disease practice in the United States. And he's witnessed 2 pandemics now, HIV and now the SARS-CoV-2. We also have Dr. Kate Mullane from the University of Chicago. She's a professor in the Department of Medicine, section of infectious disease. She's an expert in the diagnosis and treatment of infections in immunocompromised patients. She's active in the General Infectious Disease Clinic, and as the director of infectious disease clinical trials, she's currently investigating experimental agents for treating and preventing COVID-19, so that's very important as well. And we have Dr. Edward Lin, trustee of the Chicago Medical Society and co-chair of the COVID-19 task force. He's the former professor and interim chair of the Department of Obstetrics and Gynecology at Rush University Medical Center and Rush Medical College. So as you'll see, we have three doctors kind of all over the spectrum of medicine focused on COVID, and we're honored to have them here and appreciate it. Again, one more quick time, this is Congressman Kinzinger, *3 if you want to ask a question related to COVID and the vaccines. And at this time, I'll turn it over to Dr. Chundi. Dr. Chundi, thanks for being with us, and the floor is yours.
Thank you, Congressman Kinzinger. Thank you for the opportunity to talk to your constituents. So I'm a practicing infectious disease doctor, and as a background, we go to almost all the hospitals in the Chicagoland area as a group. We also are in many states, Michigan, Georgia, We're in Alabama, Arizona, and several other states. And we've taken care of an astounding figure, about 150,000 plus patients with COVID in the last 14 months or so since all this started. In fact, we took care of the second patient diagnosed with COVID in the United States, and that was at in the local facility here at St. Alexis Medical Center. And just today we're seeing the changing in the epidemic. Over the last week, 10 days, we started seeing much younger people being admitted as vaccinations have protected a lot of the older people, over 65, as Representative Kinzinger said. 79% of the people over 65 have been vaccinated. So we're seeing a lot younger people. In fact, today I saw 4 new patients at one of the local hospitals, none of which had been vaccinated. In fact, 2 had the opportunity to get vaccinated over 70, and one actually was kind of tragic. He'd been sitting by himself for over a year in Crystal Lake, and then for the recent holiday, he went to visit his family during Easter and then got infected, and he's 80-something years old and very sick. And this is where the vaccinations help, so we hope to answer these questions on vaccines today. I will let Dr. Mullane introduce herself so we can get to questions and answer as much as we can.
Hi, I'm Kate Mullane. I'm at University of Chicago. I am an infectious disease specialist there. I've been lucky enough to be involved in the research looking at the different agents that have been available for treating patients, from remdesivir to the agents that block the inflammatory response to the virus, to the antibodies, and to the vaccines. So it's been an exciting time for us, and we're excited that we've been able to have a role in helping people through this pandemic.
Dr. Lynn?
Hello, my name is Edward Lynn. I'm an obstetrician gynecologist by training, and have recently retired from my academic practice, but am very active with the Chicago Medical Society and the COVID-19 task force. And it's been my honor to represent the group from the reproductive healthcare perspective. I just want to remind everybody out there that COVID-19 infection is considered to be more problematic in a pregnant woman than a non-pregnant woman. And for this reason, the American College of OBGYN and the Society for Maternal Fetal Medicine, and even the World Health Organization, which has come on board with the recommendation that women should be offered the vaccine in pregnancy. There appears to be no reason, and now we have a large number of women who've been vaccinated with excellent outcomes. Just to remind you again that we consider pregnancy to be one of the risk factors that contributes to comorbidities, which will make you more susceptible to severe infection with COVID. And now we have data that's rapidly becoming available to us that's showing that not only does the woman do well when vaccinated, but that her antibodies, the immune defense mechanism, appears to be transferred to the baby. And this is good news because we call that passive immunity, and that's a good strategy to try to help the young babies to avoid being infected from this infection. So I'd be glad to answer more questions when we open this up for Q&A.
Well, thank you very much to our great doctors. We've got a lot of questions coming in. Again, if you want to ask a question, it's *3 to ask a question. That'll get you in the queue. We'll get to as many as we can, and you'll have an opportunity at the end, if we can't get to your question, to leave it in a voicemail kind of format. Let's go to William first in Malden. William, are you there?
Yeah.
Hey, how are you? Go ahead.
Really well. I was wondering, I got the first shot of Moderna vaccination approximately 3 weeks ago in Bureau County, and the sign on the door said, "Don't call us, we'll call you for your scheduled second shot," but I haven't got any notification or any calls about when my second shot will be. How long can you go between the first and second shot? I mean, do I have to start over if I don't get it in time? How long is that window? Why haven't I been contacted?
Well, thank you for that question. Let me add to the doctors. Maybe you can just kind of talk about a little, as well as, you know, William's question, kind of the science between the first and second shot. Do you get immunity at the first shot? We can kind of maybe kill two birds with one stone here.
Kate, you want to take that? Okay.
Sure. So there's essentially three kinds of shots right now. The live virus vaccine with Johnson & Johnson and AstraZeneca, which is a one and done. Then there's Pfizer, which is an mRNA vaccine, and that's given dose 1 and then 21 days later, dose 2. And Moderna is given baseline and then a booster at 28 days. So those dates are not in stone. There is a window on either side that they can be given. We prefer that they be given as soon as possible. In Europe, they go up to 3 months between the two doses, which we don't really agree with here in the U.S. at this point in time, because there's not a lot of good data to say that spacing them out that distance is any better than what the recommendations are from what we did in the studies. So certainly they should be contacting you. If they don't contact you by next week, where it's coming up to 28 days, I would contact them and be proactive to get your second vaccine. With the first vaccine, we know at about 14 days that you do have some immunity, not full immunity, until about 21 to 28 days. And then the importance of the booster is to prolong that immunity. And that gives us first our body's initial immune response, and then reminding our body, getting our memory cells, getting our T cells together, so that if we get exposed to the infection in the future, that we'll have a more rapid response.
That's great. Yeah. Thank you. Let me ask you, Kate, if you don't mind, can you maybe just briefly explain kind of, I know when people hear mRNA, there's some misinformation out there that says that means DNA, and that means it changes your DNA, and that's one of the conspiracies out there. Can you address maybe what mRNA means and what it does?
Sure. If you put on your thinking caps or get a headache, thinking back to high school, when we talked about DNA, when the spiral of DNA opens up, little sugars come on, nucleic acids, and hook onto that for taking the code of what we need for a protein or for an enzyme or for the cell to breathe or what have you. That little chain of messenger RNA goes out into the cytoplasm of the cell to the ribosomes, which are our factories, and the recipe is given to those ribosomes to make the protein. As soon as that protein or enzyme is made, that messenger RNA is very unstable. It is either digested by enzymes or just breaks down spontaneously. And so it doesn't hang around for a long time. When we look at the messenger RNA that is delivered in the vaccines, it's a very specific piece of information coding only for that spike protein, nothing else. It's very fragile, and that's the whole issue of it having to be frozen at -70, at -20, that if it's left out, it disintegrates. Certainly if we gave just mRNA or messenger RNA into the bloodstream without having it encapsulated in the little lipid particle that it's put into, it would be digested immediately. So it's very fragile. So it's encased now in a lipid molecule. That lipid molecule gets eaten up by our cells, and then that piece of messenger RNA is released, goes to our ribosome, makes the protein, and then it's gone. It cannot go back into the nucleus of the cell. It cannot hook up onto our DNA. It does not change our genetics.
Thank you.
I'd just like to add one other thing. The reason why the second shot is so important, especially at this time, it's Dr. Chandi here, is it boosts your level of antibodies, the stuff that protects you. And it gets it to a level that it overcomes all these variants that we're talking about. So that second shot is really important to take and not skip. because that's what's going to get us over the hump with what's circulating now, which is called the B117 strain, and then these other strains that are floating around. And we have all of them in Illinois right now. So please get your second shot. And William, I'm so glad that you're out there trying to, do the right thing. So chase them down, get your second shot.
Excellent. Yeah, I would say that, William, if you don't hear from them in, by the time you hit kind of 27, 28 days, I'd just give them a call, even if the sign said don't. Thank you. Next, we're going to go to Ottawa. It's Phil. Phil, how are you?
Hello, can you hear me?
Yep, I can hear you.
Yes. Yeah, well, I had two friends have just one. A friend just had the vaccine, and he passed away. He was 45 years old. He passed away shortly after taking the vaccine. It's worrying. And another friend just got back from Nigeria, and he was stunned that no one was wearing masks. Everyone's just walking around normal. And he asked why. He was told because they all take hydroxychloroquine from the time of children. So we just answer to these two questions. How can one of my best friends pass away right after he took the vaccine? And how come another friend just went to Nigeria and found out he's being worried about the vaccine because they all take hydroxychloroquine? And finally,
well, thank you.
Let me just finish by saying we'll never forget that you betrayed the president. And
all right,
what
thanks,
you have
Phil.
done,
I appreciate it. I got your point on that. So let's go to the doctors. What do you have to say about, if Phil has a friend that passed away after the vaccine? Is there, what? I guess I'll put it this way. What are you seeing in terms of the efficacy of the vaccine, and are people dying from a vaccine?
So it's Dr. Chundy here, and Kate will also address part of this issue because she conducted some of the clinical trials. So now we have well over 100 million doses of the Pfizer and Moderna vaccine given out, and the signals that we look for, people dying, people getting ill for other stuff, that has just not appeared. It is the safest one of the safest vaccines ever produced. Yes, you're going to get a sore arm. Yes, you're going to get a little bit of febrile illness. And I'm really sorry that his friend died. But people die of all sorts of things at various ages, especially in the 40s. Most, if you take the numbers, in young men and between and 40, they die of heart attacks. They die of other things. And if it's a vaccine-related thing, they should certainly report it. So it's highly, highly unlikely that it's beyond the background of what most people die of at that age. The second issue with hydroxychloroquine, it's clearly disproven that hydroxychloroquine has any effect on COVID. And I know the people who believe in it, it's not going to change their belief system. It's actually harmful. We used it early on in the illness, and it actually causes cardiac issues, and it's been disproven. So hydroxychloroquine, ivermectin, these drugs should not be used in COVID. And Dr. Mullane can address some of the trial issues because she's an active participant and is an active participant in the trials.
Yeah, let me just jump in real quick and tell you that on the hydroxychloroquine issue, so for whatever reason, everything in COVID has become political. And it's one of the things I am sick of and I'm fighting against. And maybe I'm an yelled at voice or whatever. But hydroxychloroquine became basically, and you heard it at the end of Phil's question too when he turned political, it basically became a proxy fight for whether or not you like Donald Trump. And quite honestly, when it comes to medicine, we should be tracking science and not politics. So as the doctors say, hydroxychloroquine is not the miracle cure to COVID. Vaccines are. So I'll turn it back to you, Kate. Go ahead.
Sure. And certainly in Africa, there is a huge epidemic with COVID. They have a variant that is causing large death rates, and it's a variant that we're really anxious about here because we know even that people who've had COVID previously are not protected from the variant. And the convalescent plasma was tried to be used in people who had the South African variant, and it did nothing. So where they may be running around happily without masks, they also have a very, very high rate of COVID infections there and are breeding mutations, so that's unhappy. When we look at mortality with the trials, this study had 1,700 FDA people reviewing the data. It was highly monitored. And in fact, the FDA was in institutions, and that's always a call that you hate to have when you're an investigator, because they come in and they go through everything with a fine-tooth comb. These studies were incredibly reviewed and monitored for safety. And as well, we're still following those patients, and we'll follow them for 2 years after the study. Finally, we have two systems where we look at safety for patients. One is called the VAERS system, which any physician who has a patient who has had an adverse event from a vaccine has to report to. It's mandated that we report. So that's one system. And the second one is the VSafe system. So when a patient gets the vaccine, we ask them, and there should be signs up for you to sign up for the VSafe system, and that is patient-recorded adverse events. Not from doctors, not watered down. It's the real deal. What a patient says happens is recorded and monitored. And so I think with these, the concern of the blood clotting and the thrombocytopenia, those were showing us that this system works. It's reported, it's evaluated. If there needs to be a pause, there's a pause, and it makes it safe for everyone.
Excellent. Thank you. Again, *3 if you want to ask a question, *3. We'll get to as many as we can. Let's go to Coal City and Joe. Are you there, Joe?
Yeah.
Hey, how are you?
Good. My question is, I've had both vaccines, or both of my shots, and I want to know if I am exposed to somebody that has it, will I carry that virus back home to my family?
That's a great question, Joe. I'll kick that over to the docs.
Yeah, Dr. Chundy here. So the vaccine has been shown to be very effective in preventing hospitalization and death. It does not prevent 100% of the time of carriage rates. There are data out there. There are trials going on out there looking at carriage rates in people who get vaccinated, and the amount of virus that they carry is very low. The risk of spreading it is low, but it's not zero. And so, if everybody in your family has been vaccinated, you're fine. Nobody needs to wear a mask, and you can all be together. If you're visiting family and friends who have not been vaccinated, and it's more than one person, you should mask up and stay, at least 3 feet apart, preferably 6 feet apart. But it doesn't prevent it 100% of the time, but it's pretty good to decrease the amount of virus being carried in your nose. Dr. Mullane or Dr. Lynn, any additions to that?
We know from the trials that they're following patients, there is a reduced viral load or amount of virus that's being carried, but it's not zero. And that's sort of intuitive because when you get a vaccine, it's to protect self. We hope by herd immunity, people not getting infected and not spewing virus because they're ill into the atmosphere, that we decrease the amount of virus that's present. And that's why it's so important that people still continue using social distancing and wearing masks, especially because we know we're not at herd immunity yet. And if you're near someone that hasn't had a vaccine, that you take precautions for them, that you're not carrying them the virus.
One last comment. Ed, go ahead, Ed.
Yeah, I ran across some data this morning, and it's getting more reassuring that the superinfection rate or the ability to be having a low-grade, what I would call subclinical infection, where you may not be aware, is probably a lot less frequent than we had anticipated, and that these vaccines are extraordinarily effective. But because of the emergence of variants and because of the fact that we just need to learn more through experience and collect more data, we still urge people to be careful, and that, if you're in a scenario where there's people around you that you don't know their vaccine status, wear your mask and socially distance is still the safest thing. Even though you've been vaccinated, you should be reassured, but don't think of it as being completely 100% protective until we have more evidence that it is.
And there is a real live world experience going on right now, which is in Israel, which has vaccinated over 60% of its population. And I think yesterday they had less than 100 total cases of COVID. So vaccinations work, and I think everyone is following Israel in the infectious disease world because they're the first ones to get a significant amount of population vaccinated. So follow that carefully, and you'll see how effective vaccinations are.
Excellent. Let's next go to Sheridan, and it's Doug. How are you, Doug?
Good. How are you guys doing? I do have a question. It kind of ties right in with that one about the vaccines. Can you guys hear me okay?
Yep, we can hear you.
So, based on what you just said and what I've heard over the last few days, at what point do we in this country say, hey, you know what? It's time to go back to normal life, and we've met some sort of certain metrics. And what is that metrics? What is it we need to meet before we can say we can move forward and get back to life as we know it?
Yeah, that's a good question, Doug. Let me, look, I'll just tell you my opinion, which is we have to be, obviously flexible. I think we are so close to getting to herd immunity. This vaccine's rolling out quickly. We should be cautious. I also have been obviously very critical of this idea of just shut everything down. But let me turn it over to the doctors for their opinions, their thoughts on, what does it take to kind of get to herd immunity and that kind of stuff.
So, hi, Dr. Chandi here. So the concept of herd immunity was actually in veterinary sciences for cattlemen and stuff like that for hand, foot, and mouth disease. But for human beings, for this virus, there's two variables. One is the virus keeps changing. Now we have a virus that's more transmissible and actually more deadly, the B117 strain that's now predominating and expected to take over the United States. So the metrics that you're looking for is basically infection rates less than 1%. And they've been you can go to the Illinois Department of Health as well as the websites, and they tell you that. And then you're looking for a sustained low rate of new infections. And that's not happening. Every time we drop down, we open up and then we bump back up. And some of it has to do with social distancing, family gatherings. And so if we get enough people vaccinated, and I think the number is fluctuating. It's going up because of this virus variant, somewhere above 75%, probably in the mid-80s. We should have very few targets for the virus to infect. Then everything kind of dies down, and you can go back to normalcy without masking, without anything else. But for the next, you're right at the goal line. You're in the red zone, ready to score and get to the end zone. If we can get to those numbers, we should be able to go back to normal life. You're talking about probably 3 to 6 months. But now the wild card in this is, and this is the nightmare that every person treating patients has, is you get a virus that breaks through it, which is the vaccines don't cover, and then we're back to square one. And that's the fear. And Dr. Mullane or Dr. Lynn, any comments on that?
Well, the way to prevent variants from developing is to prevent the virus from circulating. So the more people that are vaccinated, the less virus is around, the less likelihood it is to mutate. And so that's why you hear this push for people to be vaccinated, because we want to get this epidemic in control, and the only way to do that is to get the virus suppressed, and suppression means everyone being vaccinated.
Yeah, may I just add that until everyone's vaccinated, the second strategy, what we'll call mitigation strategy, is to avoid coming into contact with the virus. Because as Dr. Lane pointed out, people become infected, and I think everyone in the audience should just think about the fact that if a person is infected, they're producing literally hundreds of this virus. So every time that virus replicates, a mistake can occur. We call that mistake a mutation, and if that mutation is advantageous for that virus, it will persist, and then we have a variant that we're concerned about. So until you're fully vaccinated, maintaining proper distance and wearing masks, because the goal is not to get infected. If we can decrease the number of infected people, we will get on top of this pandemic. But it's happening very slowly right now.
Thank you. Let's go to Dwight. Catherine. Catherine, how are you?
I'm okay. How are you?
I'm doing good, thanks.
Yeah, my question is, I have a genetic clotting disorder called factor V Leiden, and when I was diagnosed in '98, some of the hospitals in the Chicago suburbs had no idea even about it. So now there's much more awareness, apparently. But I know what it's like to have lungs full of blood clots and not be able to take a breath, and I don't want that happening either way. And one of my concerns when they came out with vaccines of any kind was like, well, what if the reaction is more blood clots? And then, sure enough, AstraZeneca and Johnson & Johnson had people with blood clots. And nobody mentioned the factor V Leiden, but there are so many conditions that people have, and there's just no way researchers have the time and inclination to check out all of them and what the reactions are going to be. So I'm kind of concerned about that. So what kind of advice would you have? Is there one kind of vaccine I should get compared to another? I don't know.
Okay, well, thank you for the question. I'll kick it over to the doctors and also maybe add, so on top of that, is there a vaccine she should take versus other? Can you maybe talk a little, again, just about, for the people that joined, about the Johnson & Johnson situation?
Sure. Dr. Chandi here. So the risk, here it's a risk-reward thing here. So the risk, this virus, the coronavirus that causes COVID-19, we've noticed from the last year and odd, 14, 15 months now, that it has a propensity. It causes clotting. I mean, it's the most incredible amount of clotting we've seen. People who are healthy without factor V Leiden deficiency, in front of our eyes with x-rays, you could see their blood vessels clotting up because of the virus. And this is before vaccination. Because any day the virus is more thrombogenic, that means more likely to cause clots in you than any of the vaccines. Okay, that's number one. Number two, all three vaccines are safer than getting the real disease. Otherwise, why would we be vaccinating people? And then the last point is, right now the J&J is in a pause. It's not a dangerous vaccine as yet. We paused it like we're supposed to when you see signals pop up. And there's been 6 cases out of over nearly 7 million vaccines given. And so they're looking at those cases carefully to see, should there be some restrictions, or is it just a phenomenon that we're observing? And so right now it's in a pause. We're going to wait for more data. Right now the 2 vaccines that are available, both the Pfizer and the Moderna, either of them are great. And I'll turn it over to Dr. Mullane, who can have some more insight into this.
Sure. So when we look at the vaccine, the Johnson & Johnson vaccine, if you had 1 million people who got the vaccine, 5 would get a blood clot. If you look at someone who has COVID, 20 would get a blood clot. If you look at a pregnant woman, 12 of pregnant women, 1 million of them, 12 would get a blood clot like this. If someone's on oral contraceptives, up to 40 in 1 million will get a blood clot. And then when we look at the Johnson & Johnson vaccine, it would be 9 in 1 million. So it is a little bit higher than the general population, higher to equal, but certainly less risky than taking oral contraceptives or getting pregnant, and certainly much less risky than getting the virus itself.
Great. Well, thank you for that. Next, we'll go to, again, star 3 if you want to ask a question. There's a lot of people in the queue, so let me just remind everybody, if you don't get a chance, you didn't miss your opportunity. You'll be able to leave a message at the end, and we'll get you the answers to your question. We appreciate everybody spending some time with us. It's a really important issue. Let me go to Morris and Jerry. Jerry, how are you?
Hey, how's it going?
Good. How are you?
I'm doing well. Hopefully you guys are all doing well too. So my wife and I both had COVID. So we recovered, obviously. And so obviously now this has been around for a year, a little longer than that. So you guys probably have a lot more knowledge and data on this. So my question is, with antibodies, immunity, those kinds of things like that, how long, do we know how long it lasts? I mean, it seems like it's kind of changed here and there. It used to be 90 days, 6 months, forever. There's just been a lot of, I guess depends on who you listen to. I'm not anti-vaccine, but, I know they have said, the doctors said, well, if you've gotten it, you probably should still get a vaccine, but you don't need to be the first in line. And then you hear about there could be issues if you do get the vaccine and you've had coronavirus, it can cause some issues there too. And if you get it too soon or at all. So I apologize for a lot in that one question, but I think that does kind of cover a lot of people. Those of us that have, obviously have gotten the virus and then have recovered, and then the what's next? How long does it last? Do we have any more data on that, I guess?
Yeah, well, thank you, Jerry, and I'll interject some personal information. So, I got vaccinated back in December, and I got the first shot, and 5 days later, my wife actually got COVID, and I never ended up getting COVID, and I was around her. And I say all that to say that actually today she got her first shot. And, she had COVID back in December, so I'll kick that over to whoever to answer the question about should somebody that had it, get the shot and whatever you have to add on that.
Yeah, hi, Dr. Chandi here. So another piece of personal information, I had COVID, it's been a year already, last April, early on. And I didn't get that ill. And the first time vaccine was available, because we didn't know, natural immunity we know is not as good as vaccine-related immunity. The vaccine gives you much better immunity because it's directly targeted towards what makes your immune system work, and it's longer lasting. So I received the shot, and it does make you a little bit sicker than if you didn't have vaccine, especially since I'm fairly healthy. But you should get the vaccine even if you've had COVID. And the reason why you had the restrictions early on where they said hold off, you should let other people get in line in front of you, is simply because of supply. Now we have enough supply. People who have had COVID should get COVID infection should get the vaccine. And it'll give you much higher levels of protection, which will overcome any of these variants of concern that are circulating currently. Okay? So, Jerry, go ahead and get the vaccine, and you'll do well. Any additional thoughts, Dr. Mullane or Dr. Lynn?
Sure. In the studies, we did screen people to see if they had COVID previously. So many people who had COVID didn't have symptoms, and so we did have antibody titers on those patients. In the patients who had gotten COVID and then received vaccine in the trial, they had markedly enhanced antibody titers compared to what they came in with. And we were concerned early on. We know that the antibody titers in people who've had active infection in many of our patients that we were collecting for plasma, they were gone by 28 days. On average, it may be about 6 months that they're present, but not long. And as Dr. Chandi said, when it was limited vaccine, we felt that if people had the infection already, they at least had some immunity versus no immunity. And so that's why we were asking people to wait on getting their vaccine.
Interesting. Let me ask, because we're running out of time here, so there's a lot of questions in the queue. I want to maybe try to get some of them all and have you guys answer them so I can knock out as many as I can. Let me ask you a question. So there's some questions about, when are people under 16 years old going to be able to get the vaccine? So maybe you can talk about this virus in children and the issue on under 16. And the other questions about, the reaction. So if you take the vaccine, when I had my second shot, I had a fever for a day. Can you talk about maybe why that happens? Because I think there are some people out there that try to use that as an example of the vaccine being bad. And so maybe I'll kick two of those questions over to you.
Dr. Blaine, you want to take the under 16 since the trials are ongoing currently?
Sure. The trials are ongoing. Initially, we thought that it probably wouldn't be until the beginning of 2022 that the vaccines will be available for kids. We're hoping that we'll get the trials done sooner, but again, safety first. We want to make sure that the vaccines don't have any hiccups going out, and we want to protect our children. But certainly an opportunity to have your child in a study. You will be sure to have the child vaccinated before school starts. So if you're willing and your child is willing, that's a reasonable opportunity for people.
The second question was the reactions for vaccines, having fevers, COVID arms. So we've seen a lot of these vaccine reactions, which are not uncommon. You take your babies through vaccinations, you give them some Motrin or Tylenol after they start having fevers. This is just because you have an immune system that works. Your immune system is saying, hey, I recognize a virus there that shouldn't be there, and I'm making antibodies. So you get a fever. You can take a little Tylenol for it, and that should make you better. So that shouldn't dissuade you from getting a vaccine. You do get pain at the vaccination site, not at the time of vaccine, because you're such a small amount of vaccine. I didn't even feel my vaccine going in. But a day later I did. and that's not unexpected, and you take a little Tylenol and you kind of shrug it off and move on because it's going to give you protection. I'll tell you, the peace of mind I got from taking my vaccine was unbelievable. Even though I had COVID before, it really gave me peace of mind that my family's safe and I'm not going to spread it to my family. So that was a big deal for me.
Well, let me appreciate that. Let me do one more question here, and then I'll close it up. But let's go real quick to Stan and Pawpaw. Stan, how are you?
I'm good.
Good.
Yeah. Thanks for doing this. By the way, this is really, really terrific. So my question is in regards to vaccine hesitancy. Where I'm at out in Lee County, it's very rural, and a lot of people out here don't wear masks anymore. They're treating it as if it's all over, and I know that the numbers are still considerably low out here. I'm just worried that we're not going to get to quote-unquote herd immunity if people aren't willing to take the vaccine, and I hear a lot of that in conversations out here.
Excellent. Well, let me address that for a second. I'll turn it to the doctors. Look, there's all this rage out there now. People talk about vaccine passports and all this kind of stuff and the government XYZ. Look, anytime you put your kid in public school, you got to show your kid that your kid has had vaccines. This is no, new world order. It's not the end of the world. The Antichrist isn't going to, come up from the COVID vaccine. This is, people out there trying to create rage because they can get attention for it. And unfortunately, they're abusing frankly, the real fears that people have when it comes to the virus. And I would just encourage anybody on the call, if you hear something outrageous or crazy or whatever, do your own research on it, because there are a lot of people that want to make money on your fear, and there's a lot of countries, i.e. Russia, that want to try to make you hesitant so that more of you die. That's the truth of it. They want chaos. And I think that's very important to point out. But if I'll turn it over to the doctors for the discussion of vaccine hesitancy, and then maybe any closing comments you have.
Yeah, I have a comment. Are you able to hear me?
Yep.
I just want to go back to something that we were talking about earlier, but just to kind of emphasize this to the audience. So right now, it's been estimated that we've given over 150 million doses in the United States so far. And the serious side effect rate has been established at, right now, it's at 0.005%. So, it's just a small fraction of a percent of people that really had a problem. So this is an extraordinarily safe vaccine. And certainly, when you look at the number of people that have had severe illness and death from COVID, this it overwhelms you when you start looking at the numbers compared to the vaccine. So I appreciate that people were concerned about a vaccine As you pointed out, Congressman, there's a lot of misinformation for a variety of reasons. There are people that are inherently against vaccination in general. Truthfully, this is not the time to play roulette with your body because it can be very serious. I know that when I had my vaccination, and as Dr. Chundy pointed out, the most common thing is a sore arm. With the second dose, and I had the Moderna, but they're virtually identical when you look at the rates of reaction. The Pfizer and the Moderna vaccine. The second dose, you'll tend to have a more severe response, so to speak, because the immune system has been primed. And so now and all I kept on saying to myself is, this vaccine's working, and I was getting a lot of reassurance from it. It's also younger people who have much stronger immune systems tend to be a little bit more symptomatic than older people. And since I'm in that high risk above the age 65 group, I wanted to call my friends and say my immune system's younger than I thought it was. Because of, but the reality is that we need to work with people to educate, to try to understand their questions, not dismiss them, respect the fact that people may be cautious, and this is what we're teaching all of our healthcare providers, to try to deal with this, because we understand that acceptance for this vaccine for some people is a little bit hard because they don't fully understand it, and unfortunately they're not getting their information from reliable sources. And I'll just invite anyone that has a question, reach out to the medical society, and we'll try to get you an answer.
Yeah, and I'd like to thank Representative Kinzinger, because he's really gone out of his way to, get as many people good information as possible about this. And so, this is a good format. This is a good way of getting your, answers from the horse's mouth, as they say. So thank you, Representative Kinzinger, for allowing the opportunity.
You bet. Dr. Mullane, do you have any closing thoughts?
Just that all the vaccines are safe. All the vaccines are effective. We're following people for 2 years afterwards to make sure that safety is maintained. And I think that knowing that so much has gone into this, none of the vaccines are new. The first mRNA vaccines were first developed in '89, so it's not a brand new vaccine. It's just that the technology has caught up to the ability to produce. And so I think we're in a really lucky period of time that we were able to jump on this platform, get these vaccines out, and to protect people. We've already had in the United States too many deaths, and worldwide too many deaths. And so we need to curb that.
Well, wonderful. Well, to our doctors, I'm sure everybody would agree, thank you for being on the front lines of this fight. We hope you don't have to be on the front lines of this much longer. We appreciate your service. Thank you for spending this time with us and overcoming some of this misinformation and reassuring folks, if you're on the line still, just go get vaccinated when you can. Make it a priority. And also, if you didn't get a chance to ask your question, I'm sorry, we're limited on time, but everybody on the call will get a chance to leave a message that I'll hear, and we can either answer your question or at least hear your opinion on things. So thank you very much. I hope everybody has a wonderful night and a great week. Take care.
Thank you.
Thank you.